All right, can we all see the PowerPoint?
Yes, we can.
Perfect. So we are from Volunteers of America. So this is a statewide organization. We specifically work with the Supportive Services for Veteran Families program. You'll notice our name up here a lot in Northern Colorado. We have a few other programs in the area. Our senior services programs up in Fort Collins. And then we also have a rapid rehousing program that works with those that are justice involved, the CORE program. They also represent Volunteers of America, just separate programs. So a little bit about us. Our mission here with SSVF is to end veteran homelessness. We do this using the Housing First model. I'm sure many of you are familiar, but this is the model that all persons deserve access to housing without preconditions as quickly as possible. Client choice is also a big pillar of our program. We provide all of our veterans with the choice of where they live, when they move into housing, and what their journey looks like.
All right, I want to slide right on into some core values that we utilize while facilitating our case management services. So first, want to highlight integrity. So we do this on all fronts, not only with our clients that we serve, but also with our partner agencies as well in the community. So really just being transparent in the way that we're able to provide services, so what we can and what we cannot do. Again, our program does have parameters that we're not able to step outside of. Next, fidelity. I can definitely say that all of our staff do go above and beyond with providing that high level of quality services when it comes to case management, and also sourcing out alternate funding resources if need be, or just general other supportive services as well. So that could be public benefits, work connecting to the VSO agencies in that area as well. And finally, with humanity, we do believe in meeting our clients where they're at, right? So we don't take any barriers into consideration in working with them. As far as that being a preventative kind of, I guess you could say, preventing them from getting into housing, we definitely see advocation is a huge thing that we're able to accomplish. So with that being said, with these core values, we utilize these when we're doing rapid rehousing, housing first, harm reduction, motivational interviewing, trauma-informed care, and critical time intervention, which are all a part of our wraparound case management services that we will definitely speak about just a little bit later in our presentation.
This next slide just kind of talks about partners that we have in the community over in Weld and Larimer counties. There's many more partners that we work with. These are just kind of the most common ones. A lot of veteran providers in the area and a lot of ways to work with local homeless service providers.
All right, so this slide definitely emphasizes our collaboration with the VA. Hunter, I don't know if you want to say a little bit more about this part as well, but in the meantime, again, we are grant funded from the National VA in Washington, D.C., more specifically. And of course, we enjoy our collaboration with the VA, but we are not considered actual VA employees. That has been a misconception that we've experienced in the past from other partner agencies. So we definitely want to highlight that as well. Next, we do work closely with our VA to achieve goals set by the National VA. So I know Hunter kind of mentioned just a little bit about that as well in the kind of the Built for Zero conversation there. And our housing efforts and our housing effort across the country as well. And then our VA that we work closely with is Cheyenne, and they help support our Northern Colorado offices. So again, covering that Weld County, Eastern Plains, and Larimer counties as well.
Hey, I don't have anything to add right now. Maybe once you finish up with your presentation, I can just talk specifically about some of the transitional shelter and permanent housing resources to supplement the info you all have provided. But don't want to interrupt too much now.
Wonderful. Well, we'll move on to the next slide here. This talks about who we serve. So we have 3 core eligibility criteria. First being member of a veteran family. So this is where there must be someone actively living in the household that is a veteran. Often we get people who their grandfather was a veteran, or maybe their partner was a veteran, but they don't live together anymore. Unfortunately, they do need to be in the household to be enrolled in our program. Member of a veteran household can be a little bit vague sometimes. We can help those that have participated in like the National Guard, the reserves. There's certain criteria that they have to meet in those situations, but we have several people who didn't think they were a veteran, but we pull up some of their records and we actually are able to help them. So if this is in question, just go ahead and refer them to us because we can find out almost immediately if they would be eligible for our program. Next criteria is income limits. So our typical program participant falls below 50% of the area median income. Often our veterans fall much lower than that, below 30% area median income. In some cases, there are those who we can help serve that are between the 50 and 80% area median income. This can be a little bit tricky because they do have to get some certain approvals and things of that nature. Typically, clients in that situation would be if someone lost their job and they're in between jobs and trying to not lose housing in the meantime. Sometimes we can kind of help people in that situation. And then housing eligibility kind of falls into two categories for us. We have our rapid rehousing clients, and those are clients that are experiencing literal homelessness. That could be at the shelter, streets, whatever their situation is. And then those who are at risk of losing housing. So these are our homeless prevention clients. They typically are facing eviction, have notices to pay, notices of non-renewal, that kind of thing. So as long as they meet those three core criteria, we can get them enrolled. But there's a little note there on the bottom. Eligibility can be a little complicated. Best course of action is just to always refer them to us. Even if we can't help them, we do try to call other agencies and get them connected.
Thank you, Kimberly. So moving forward here, I know I had mentioned this earlier about our case management services that we provide. I do want to emphasize that we are a wraparound case management program first and foremost. But I do want to preface, we do have the ability at times to provide monetary assistance. So again, that really comes down to primarily security deposit, first month's rent, maybe even application fees. Those are the primary types of monetary assistance that we have in the past been able to provide. But again, we are grant funded, so we have limitations on the amount of monetary assistance that we're able to provide. So outside of that, for our wraparound case management services that we do provide, some of these case management services, they do not have to be enrolled in our program entirely. And now I'm actually referring to our light touch case management services. So typically these are the veterans who are ineligible for our program. That could be maybe due to housing status, veteran status, income, stuff like that. So what we do is we just keep in touch with them on a weekly basis, provide them resources to various programs out here in the community if need be. So that could be maybe public benefits, connecting them to the VSO, so on and so forth. But moving forward from there, once a participant is fully enrolled in our program, we do provide housing search assistance. So that can also be at times a little tricky just because we do have participants coming into our program who have, just a variety of, background experiences. So that really comes in with our advocacy piece. As far as working with property management companies who either we have worked with in the past or we're trying to start up a new relationship with. We do a part with tenant training. So once we have a participant who is actively housed, we do our best to go over their lease, ensure that they have their lease and they have the understanding of how to be a good tenant, right? So not having, 15 of their closest friends come over in one day or throughout the week and stay the night, stuff like that. Next, we do connect pretty closely with the Weld County and Larimer County Human Service Building for public benefit assistance. We also have a very close connection for VA benefits. So if it's not having our participants call the Health Eligibility Center line, it's simply referring them over to the Veteran Service Office as well. Employment services, we have a close connection to HVRP. veteran employment services up in the Larimer County area. And we are also very closely tied with the Will County Human Services, Employment Services, as well. So additionally, we do have budgeting resources and another really unique component of our program, which again, a participant has to be fully enrolled in our SSVF services. We have a partnership with Colorado Poverty Law Project, or CPLP for short. So therefore, we are able to further help our participants who have those types of, maybe some criminal history background or maybe eviction background, stuff like that. And helping them get connected to legal services quicker has actually been quite beneficial and really has helped a lot of our participants get housed quicker as well. So that's a little bit about our wraparound case management services.
This next slide here talks about additional services that we have. So in the last few years, the VA has expanded the types of service that we provide to kind of reach a broader audience. So these are the results of that. The first one here, Returning Home, that is a program where we can help veterans return to their community of origin or to a community where they have social supports, other types of supports. So for example, we had a veteran just a few months ago who had come here from North Carolina. His whole family lived in North Carolina still, and he was able to return home to them. So we were able to fund his travel, meals, stuff like that, to get him back to his community of origin where he has some social supports. Shallow Subsidy, this is a program where if they've been enrolled in our program for a little while and they're kind of demonstrating an ability to manage their housing on their own, manage their budget, but maybe they need like a little bit longer term light touch support, they can potentially enter this program where they can get 2 years of a 50% subsidy towards their rent. This program is kind of evolving within BOA, so it's changed a little bit lately. It's not always a guarantee for people to get in. We don't really advertise it to the veterans, just because you do need to demonstrate your ability to maintain housing for a few months in order to enter the program, and that can be a little tricky sometimes. Rapid Resolution, that program basically aims to keep veterans housed where they're at. So if someone is living with family, living with a friend, we can sort of provide some monetary assistance if they are allowed to stay there for a predetermined amount of time. Rapid Rehousing to HUD-VASH is the last one I have listed here. So this HUD-VASH provides housing vouchers with case management support. Typically, we would assign these vouchers during our coordinated entry system. Sometimes we do it a little bit of a backwards way, where we get the veteran housed, and then when we kind of determine that they are going to need that longer term support, we can fill out an application and work directly with the VA to provide that service. All of these programs still have their own unique set of eligibility. So if anybody's interested or may meet the qualifications for that, just go ahead and reach out to us and we can always provide more information.
Thank you, Kimberly. So moving forward here, Kimberly has actually been able to pull some data between our Greeley and Fort Collins SSVF offices. So these are some targets, and then the progress is reflecting as of today numbers and percentages. So we do serve about 260 unique veteran households per year. All right, that's our average. But at this time, between our Greeley and Fort Collins offices, we have served 181 unique veteran households. And that has been since the beginning of our grant year, which was back in October 1 of 2023. So we are well on our way to meet our goal and hopefully exceed that. Moving forward here, we do serve, again, our unhoused population. So when we serve them, we do seek to get them housing within the first 90 days of their enrollment. That's our goal. But at this time, on average, we have about 70% of our unhoused clients move into permanent housing within 90 days. And I do kind of want to note, you might be thinking the other 30%, like what does that typically entail? And unfortunately, that could just be a few different reasons as to why maybe they weren't able to achieve housing within that timeline. But eventually they do meet that housing need. But again, that could just be just because of barriers or maybe housing at this time is just not on their journey. So it could be a few different reasons. Moving forward here, we do focus on the 30% area median income individuals along with the OIF, OEF, O&D. So again, that's Operation Iraqi Freedom, Operation Enduring Freedom, and Operation New Dawn. So those are all, I believe, post-2001 eras, military eras, and families, right? So at this time, we have served 132 households who are below 30% area median income, 29 OEF, OIF, O&D veterans, and a total of 37 families. So our data is definitely robust, and we are moving forward with hopefully exceeding our numbers again this year.
Last little slide is a myth or fact slide about our program. So first one here, SSVF is a financial assistance program. That is a myth. We are a housing case management program that can assist monetarily when appropriate. SSVF only works with those experiencing literal homelessness, also a myth. We can also sometimes help with those facing housing loss, such as our homeless prevention folks. SSVF is a part of the Veterans Administration. This is a myth and a fact. So SSVF is 100% funded by the VA, but we are not run by the VA. Our grant is run by Volunteers of America. Next one here, we only enroll single adults. That is a myth. We work with all members of a veteran household. We provide long-term assistance, again, a myth. This is meant to be a short-term program. Typically, our clients stay anywhere between 3 and 9 months, just kind of depends. Justice involvement prevents veterans from accessing SSVF. This is a myth. There are no justice involvement things that would be considered a barrier to enter our program or to participate in our program. And then last little slide here is just how to get in touch with us. We do have office hours at different locations across the community that are listed here. Typically, if you have a veteran in need, this number here in red is always the best contact. That goes directly to our intake and screening line, and they can help assess any needs.
Thank you, everybody, for your time.
Thanks, everyone.
Hunter, did you want to add on some?
Yeah. Thanks, Lyle, and thanks, Kimberly and Jessica. Y'all can hear me okay?
Yep,
I'm gonna
we can
have
hear you.
to be brief. I have to jump off at 10 for a meeting. Unfortunately, I can't miss. So I'm gonna go quickly. I'm gonna try and share my screen here. See if this will work for me. Struggling to get this to work. Can you all see that?
There, it's coming on.
See it?
Yeah, we got it.
Awesome. All right. I'm just going to do, like I said, just a real high level overview of some of the housing programs, permanent supportive housing and transitional programs we can offer at the VA that supplement a lot of the services you heard about through the SSVF program managed by VOA. There's also another SSVF grantee in Northern Colorado, it's Rocky Mountain Human Services. They manage the same grant, so same services there. Real quick, so the VA housing resources, we have a range of opportunities for veterans as they work, their own goals towards permanent housing. Grant per diem and contract residential shelter programs are more the transitional housing focus. HUD-VASH, which many folks have heard of, is the permanent supportive housing program through the VA in partnership with HUD. And then you heard about SSVF, supportive services for veteran families. Just to break each down, bit further, HUD-VASH, like I said, is a partnership between Housing and Urban Development and the VA. It is a permanent supportive housing program. There are tenant-based and project-based vouchers. We have project-based sites in Northern Colorado at the Edge in Loveland, and then Mason Place and Redtail in Fort Collins. Intended for veterans with intensive case management needs. So you're thinking higher on the VI SPDAT as we currently assess folks in our CoC using that as a tool. Christine mentioned that we're looking to shift that, but still intended for veterans with the most intensive case management needs, higher vulnerabilities. We generally tend to prefer chronically homeless veterans, knowing that oftentimes they are the most vulnerable. There's some legal barriers to accessing the resource, primarily having to register on a lifetime sex offender registry. The only other eligibility piece would be income. Veterans in veteran households have to be below 50% AMI. The Cheyenne VA Homeless Program dedicates all of our HUD-VASH resources to the coordinated entry process. So referrals are coming right from that by name list in the CAP system that Christine spoke about. Grant Per Diem is a bridge housing transitional program in Cheyenne. It's 90 days, so short, meant for veterans that really have a pretty solid housing plan entering the program. GPD, it can be used up to 3 times in a veteran's lifetime, and that's across the country. There are GPD programs throughout the nation. We just have one in our catchment area, and then there's a handful in Denver, probably 3 or 4. Contract Emergency Residential Shelter Program is a bit looser in its time frame, but generally around 4 months. Those sites in Northern Colorado are at Fort Collins Catholic Charities in Greeley, Guadalupe Catholic Charities. There are veteran beds set aside, and it's a contract with the VA. The difference here for those programs is veterans have to have full healthcare eligibility with the VA to be eligible. For many of our other homeless programs, that's not the case. Veterans really just need 1 day of active duty to be eligible. All right, I'm gonna go fast. Let's see if I can figure out how to stop this. I want to show you all just quick, some quick data for the national goals. If I can figure out, did I stop sharing my screen on your end?
Yes,
Yes.
it's we're seeing you again.
Okay, great. Well, I guess maybe, depending on how you look at it.
Your beard looks great, so.
Okay, I'm gonna do this quickly, and then unfortunately I've got to run. But so in addition to our goal of reaching functional zero locally, National VA has an annual goal to house a certain number of veterans across the country. The last couple years, it's been 38,000 veterans. This year, it's 41,000 veterans. The national goal to place veterans into permanent housing, and they slice that goal up into each region by medical healthcare system. So we have our slice of the pie, which is 163 veterans, and that is in Cheyenne. So think of Cheyenne and Laramie, as well as Northern Colorado. This was updated actually yesterday. So this is data through April. We've currently housed in our healthcare catchment system, we've housed 73 veterans. Our goal is 163. And this is not a calendar year goal. This is a fiscal year goal. We're about halfway through. So a little bit behind in our goal, but these numbers really align well with our functional zero numbers as well, hoping to house around 18, maybe more each month to reach this goal, and also to reach the functional zero goal. There are 2 additional pieces to this: the prevention of returns to homelessness, as well as engaging unsheltered veterans, both of which our system really excels at. I think engaging the unsheltered veterans, that piece just speaks loudly to the need in the area. We generally knock this out of the park. And then preventing returns to homelessness just speaks to the wraparound services we connect veterans with once they're in housing. With that, I really apologize, but I've got to go. If there are any other questions about VA services, connecting veterans with healthcare, homeless program, or checking into eligibility, please don't hesitate to reach out. I'll drop my info in the chat. Thanks for the opportunity.
Thanks, Hunter.
Take care.
Have a good day. Does anyone have any questions of Kimberly or Jessica? Okay, great. And Kimberly and Jessica, just to put in my kind of nomenclature, I think that SFVF is the equivalent of a rapid rehousing program. Is that right? Or maybe that's not a perfect overlay.
Correct. You're absolutely right with that. So we are a rapid rehousing program.
Yeah,
You're correct.
great.
Yeah.
Great.
Yep.
And I'm going to, so if no other questions, I'm actually going to put in the chat a link to the Community Solutions website that has some articles on veteran homelessness. And just as just even more of a high level understanding of veteran homelessness is that veteran homelessness has been reduced nationwide by 55% since 2010. And it's because during the Obama administration, there was this decision to make veteran homelessness the focus of federal efforts, along with other resources, but really to go deep on veterans homelessness and establish programs like SSVF and VASH. So that has created a lot of nationwide success. I did notice on that Community Solutions page that Denver last year, 2023, reduced veteran homelessness by 21%. And that another thing, and Christine, you can pop back in if you'd like to. One of the things about our veteran homelessness population is for a number of periods, if not also right now, our veterans have a resource. They have a housing voucher, or they have a rapid rehousing opportunity. But what we don't have is housing, for them to use. So if we can increase the number of housing opportunities for veterans, then we will, they can use those resources if we can just have more housing. Is that correct, Jessica and Christine, or Kimberly? Is that what is that an accurate statement?
I would have to say, like, to a degree there, Lyle. I think housing across the board for veterans and non-veterans can be a bit challenging, just given that, rent increases have gone up, and that really weeds out those who might have meager income or no income at all. And there are plenty of properties who don't want to work with an individual who has little to no income, despite our efforts in advocacy. So I think the statement of if have enough veterans and having the housing piece, I think it just really depends on the area and the availability of housing at that time, and what the participants, I guess you could say, level of income, if any, looks like as well. So I hope that answers your question, Lyle. Was there something else that you wanted me to answer, or?
No, that's great.
Okay.
It's difficult given the housing market.
Yeah.
But even
Yeah,
if they do have a
exactly.
resource. Yeah.
Exactly. Even with a resource. And actually, I know Hunter is not on here at this time, but there have been times where we have had veterans who have had a housing resource, right? But ultimately, it will come to be that they are over income for that housing resource. Our housing resources do have income limits as well. And unfortunately, they can be rendered ineligible due to their income. So that can also be a bit of a yes and a no answer as well, Lyle. So again, sorry, it's kind of vague, but I hope that also kind of answered your question.
You bet. Thank you. I don't know if it was a question. You just need to refute my understanding. So, so any other questions or comments for Kimberly or Jessica? Okay, my last comment. That was a
Wait,
fantastic.
sorry, I couldn't get off mute.
Go ahead, Alison. Go ahead. Yeah.
So do you have numbers for people who enter back into homelessness as well?
Oh, so are you kind of referring to like, maybe they're enrolled in our program and then like they lose housing while in our program, or outside of that? Oh, okay.
So they enter your program, they get housed. Maybe they have exited your program how long after they're housed, did you say this? Do they stay in your program?
So it just really depends. So we're a short-term program, so
Yeah.
6 to 9 months is on average. For those who exit our program and maybe they do return back to literal homelessness, we may or may not know about that, right? So maybe they do come back to us, or maybe they don't come back to us. So we don't have any data on that, unfortunately. But if they were to come back to our program, as far as the data goes, I definitely would have to reach out to QA. That's a little more extensive than what we just generally pull anyways for our reports. So, I can
I'm-
definitely.
I'm not
Yeah.
asking if you have the number. I'm asking if
Oh,
you
okay.
track the number. So if somebody maybe they exit your program, maybe they don't. Well, yeah, let's say in this example, they exit your program. They were expected to be 6 months. They lose their housing in month 9,
Okay.
come back. Do you register that as having lost housing? And do you track that data?
So we won't track it as a loss of housing if they exited our program and after that they had lost their housing. But if they were in our program and they lost their housing, we do our best to keep them in our program, of course, just granted they're still eligible for our services. And we just continue forward with providing them services until they hopefully get housed again. So if they're in our program, they lose housing, we continue our work with them. But if they are exited and then lose their housing thereafter, but they do return back,
Yes.
then we count that as they are unhoused at this time and we move forward from there. So we'll
Okay.
just count it as like a second enrollment.
I'm asking because this is a hot topic data point.
Yeah.
Maybe this is a conversation with Betsy. Betsy, I don't know if you're on here, but I've been asked a number of times, not all the time, but enough times that I've taken notice how many people return to homelessness. And I remember actually like 12 years ago when we first got that graphic that Christine used around coordinated entry, like when that was first presented to the continuum of care, rapid rehousing's history came from the Great Recession. I feel like former council member Rich Ball in Loveland right now. So it came from federal funding called HPRP, and so I was super shocked that rapid rehousing would be used for somebody who may or could be chronically homeless. And at that time, there were questions around entering back into homelessness that I think are still valid data points. Is that not something that your team has discussed tracking?
So I guess just to be transparent here, I guess you could say I will mostly defer to Betsy on this answer, but we really want to highlight those that we are able to help house and hopefully have them maintain self-sufficiency when it comes to housing. So I'll definitely let Betsy follow up with you further on that.
Thank you.
That
Appreciate
way,
it.
yeah. Of
All
course,
right.
yeah.
Thanks for answering.
I do think Allison and Christine can correct me again. I do think that would be included in CAPS. If a person is housed and then they lose housing, then they most likely will be included on the by name list. Is that correct, Christine?
I mean, yeah, that's tracked. We're working on a lot of different ways to capture the returns to homelessness. It's complicated. We can do it for the veteran population because it's such a smaller number, but it's a lot of manual work on Sophie's part to kind of look at the HMIS history and really track, is this a true return to homelessness? Were they inactive, like out of state in a different CoC? There's just so many different factors. And so we understand how important that metric is. Unfortunately, it's incredibly difficult to really pinpoint, but we are working with the HMIS team, and Sophie's doing a lot of work too to try to figure out the best way to capture that data and feel confident in the source.
Appreciate that. Thank you.
Additionally, that's why our QA team, they're really great with pulling those numbers as well for us.
We do have a metric that is available. I think it's posted online, and it is basically it looks at the number of like new enrollments in coordinated entry and what percent of those enrollments are people who have never been in CAPS before. What percent are people who have been in CAPS before with permanent housing? And then I think the final thing has been in CAPS before And this is just kind of like a return to coordinated entry and not necessarily that they had housing in between their two enrollments. So there is a little bit of a breakdown, and I can share that with you on the side, Allison.
Rachel, why don't you go ahead and move on, go to your presentation. if you
Oh,
don't mind,
sure.
On the pit and
Yeah,
the
so
hick.
yeah, so the point in time count happened in January of 2024, so a few months ago. And we have some data to present on both the point in time and the housing inventory count. And just to kind of communicate like why we don't present for so long, like we collected that information January 30th and in February, and it's now May 16th, and we're just now kind of presenting to the community. A lot of that has to do with the HUD's timeline and how and when they allow us to submit our information to them. And so this year there was a lot of kind of back and forth with the CoCs because HUD has a new repository tool for the hick and pit. And so there was a lot of kind of like just hiccup with that process. And so our data did not officially get submitted to HUD. Actually, all CoC's data, not just ours, did not officially get submitted to HUD until May 10th. So that process just ended for us, but for you all, it might seem like it ended a long time ago, but it was less than a week ago that we officially submitted. So we're pleased to be able to finally present some information to you all. So the first thing I'm going to share is the point in time count. And this, I believe, will be available on the CoC website for folks to be able to navigate on their own and kind of walk through and explore the different ways that you can look at this data. But this is our point in time count. There were 893 people experiencing homelessness in Northern Colorado on the night of January 30th, 2024. This number only increased by about 10 or 11 people from 2023, so not a significant jump there by any means. Here we can see the breakdown of what percentage of those folks were sheltered versus unsheltered. And when we say sheltered, that means they're either in an emergency shelter, a motel paid for by an agency, or transitional housing. And unsheltered is anywhere that is just a place not meant for habitation. So that could be in their car, camping on the streets, etc. You do not get counted in this if you are in a motel that you're paying for on your own, or if you're staying with family or friends. So the breakdown is about 70% sheltered, 30% unsheltered. You could see that it's about 39% of the count is represented in Weld County, and the remaining 61% is Larimer County. You can filter this dashboard based off of city if you want to get a little bit more granular and where people were counted. These are all the cities where people appeared in the count: Del Camino, Estes Park, Evans, Fort Collins, Fort Lupton, Greeley, Loveland, and Windsor. You can also sort by household type. So if you want to look at families or just single adults, and this year we actually counted a couple of unaccompanied youth under the age of 18. So that would be a household with only children in it. Whether or not the household was experiencing chronic homelessness. So chronic homelessness means that the household is experiencing long-term homelessness, not episodic. And they also have a disabling condition that is long-term, something that prevents them from gaining employment or securing housing. And then we can also break this down by veteran households. Scrolling down, you'll see the demographics of the population. So race and ethnicity, age, gender, and disabling conditions. Something to note that is pretty significant is race and ethnicity is tracked differently this year than it was in previous years. So that's a pretty big shift. And so what you'll see most notably is the percentage of people who appear as white has gone down pretty significantly in looking at it year over year. And that's because people who used to identify as both Hispanic and white were being counted as white, and then the ethnicity was broken out separately. So that's a big change that you might notice. The gender options have been broken down a bit further as well. No other changes. And then you'll notice these asterisks here. So the asterisk means that there are people that were counted in that category, but the number of people counted there was less than 5. So we do something called cell suppression to protect the identity of those individuals, so that you can't identify anybody using this dashboard, essentially. So just a little note about that. And then how was this information collected? So we pull majority of the information from HMIS, and then the rest comes from surveys that are conducted by volunteers and providers using the Survey 123 software. And then we also put a list of agencies here who participated in the point in time count, whether that means their data was collected from HMIS or they helped participate by going out and conducting surveys. Does anybody have any questions about the point in time? Again, this will be available online for folks to navigate on their own as they need to.
Rachel, were there any notables when comparing 2023 to 2024? I mean, one notable is that we only have, I mean, I'll make an observation. I know the count was more thorough this year than prior years, just due to increased planning that Kelly oversaw and worked with all you all staff on. So I think that's one thing, and knowing that it only increased by about a dozen people is actually quite surprising, given the greater thoroughness of the count. Is there anything you would point out difference year to year?
I don't think there was a significant change, actually. So when we submit our point in time count, when we enter our numbers, HUD asks for explanations of changes. And our numbers, when you break them down by sheltered, unsheltered, the total count, everything was so similar that we essentially did not provide explanations. It was just like our numbers did not change significantly enough to say that there was a huge shift or anything like that. So I think our unsheltered number, total number may have gone up slightly, but I think the percentages remain the same of the breakdown of people sheltered versus unsheltered. So again, we had like a slight increase, about a dozen people. I think I would have to pull up the last year's dashboard, but I think the increase shows up in the unsheltered, but nothing significant. So Kelly Pryor is, I believe the Northern or United Way has contracted out with Kelly Pryor. She's going to be doing a PIT kind of report where she'll release some information on the comparison of the year over year with a focus on race and ethnicity, the disparities that lie within that data, and then any kind of changes to the data overall. So more to come. I'm going to move on to the housing inventory count if there are no other questions about the point in time. So the housing inventory count is conducted on the same night as the point in time. So this is a count of the total number of resources that are available in the community for people who are experiencing homelessness. But the difference is that this includes permanent housing resources. So that would be PSH, rapid rehousing, and other permanent housing. And so this is looking at, first, we're looking at the total beds available, and then kind of broken up by project type and county. And so you can see emergency shelter beds in Larimer County, 409, 200 in Weld County, PSH resources in Larimer County, 436, 166 in Weld County, rapid rehousing, 66 beds, 62 here, transitional housing, 41 and 88. And again, remember, Weld County makes up for about 39% of the point in time count. There obviously there's a smaller population there, so we're going to expect to see higher bed counts in Larimer County, but you can there's definitely still kind of a glaring difference in the number of PSH resources available in Larimer County versus Weld County. But the other interesting thing is that rapid rehousing is about the same across the counties, despite the fact that Larimer County is much larger. And same with transitional housing. There's more transitional housing and rapid rehousing in Weld County, versus compared to Larimer County. And those are the resources for people who have obviously lower vulnerability. So less needs, you would go into transitional housing or rapid rehousing with the anticipation of self-resolving eventually. Larimer and Weld County, those are the VOA and Rocky Mountain Human Services, they have shell programs for all of Northern Colorado. So we don't actually know where those beds live precisely within the CoC. Any questions about bed counts? I'm going to move on to utilization. So this is how these beds were utilized on the night of the point in time count. So of the beds that were available, how many of them were occupied? And this is across both, again, Larimer and Weld County broken up, and then by project type as well. So you can see that in Larimer County, 78% of the emergency shelter beds were occupied, 88% of the beds in Weld County were occupied, close to 100% on all of permanent housing resources. And then 61% of transitional housing was occupied and 78% was occupied in Weld County. And then we do break out the DV provider just because those beds are obviously filled in a different manner than the rest of the beds in the CoC. So if you remove these, you can see that the emergency shelter beds do reach a higher occupancy rate in Larimer County. So just wanted to show that. Any questions about utilization rate?
Rachel, do you have any speculation on why the transitional housing beds are so much less utilized? Or I guess similar to emergency shelter anyway.
Yeah, I mean, transitional housing is higher barrier, right? So when you're in transitional housing, there's more requirements of individuals there's expectations to be met in transitional housing. So it's not like, for example, emergency shelter, a majority of these beds in emergency shelter are low barrier beds, right? So anyone can access those. And so I think it's more a reflection of the population's ability to access those beds and how those beds, I guess, are just serving the people that are in the community and what their needs are. So I think it's just the nature of transitional housing. Anyone else who's a transitional housing provider or anyone else on the call is welcome to kind of jump in and speak to that a little bit more.
Rachel, are you able to share, can you give an example of one or maybe two in Larimer and Weld, the programs that offer transitional housing, just to call that out to give it a little bit of a name?
So the transitional housing in Fort Collins that comes to mind, they're for families. So there's the Family Bridge House in Loveland that is ran by House and Neighborly Service. And then there is the Sherwood House in Fort Collins that's ran by Family Housing Network. And then in Weld County, there's the Camfield Corner Apartments that is ran by Greeley Family House. And then there's the Jobs of Hope Transitional Housing that is for people with justice involvement. And so, yeah, even as I list those off, the majority of transitional housing is for families. And that's what we see most often in the communities. And then you have the kind of singular transitional housing for justice involved.
Thank you. That's helpful. Is that similar to what you see maybe across the state, that transitional housing focuses in on families? Based on HMIS data?
I couldn't say for sure. I do think that transitional housing is focused on special populations. So like there's very little transitional housing that is just for like anyone, kind of like all populations or single adults essentially. So yeah.
Thank you. I think, actually, sorry, I'll just poke in just a minute. I think that also speaks to that utilization that Lyle was talking about as well. We see the largest population as being single men in our community. So if the transitional housing is focusing in on those families, it would make sense to have a little bit less utilization since it's a smaller population and it's specialized. Would you say that that's true? Okay.
Yeah. The other thing that I did not mention is that one of the reasons that we break down the housing inventory count data in this manner is because this is how we kind of get graded on as a CoC essentially. So when the NoFo comes around, some of the questions that they ask are, what was your utilization rates for these different types of projects? If it was low, why was it low? And then kind of looking at how many beds we have available. Specifically, they like to see rapid rehousing beds in your community increasing. And then finally, HMIS participation rate. This is another one that we kind of are graded on as a CoC. And so this is looking at the number of projects that are eligible to enter into HMIS, which ones do. And so this is, I wanted to break this down in two different ways. On the left side, you'll see the percentage of projects that are entering into HMIS by project type. And on the right side is their total beds and how the size of the program and the impact that that has on the participation rate. So looking at Larimer County, we have really great HMIS coverage across projects, right? You can see that there's just 3 PSH projects that are not entering into HMIS out of all the project types that can enter. But if you look at how many beds those 3 PSH projects comprise of, is 50% of all PSH beds in Larimer County are not being entered into HMIS. Looking at the VOA, Rocky Mountain Human Services, they enter everything into HMIS that they, for the beds that they have. And then looking at Weld County Emergency Shelter, you can see that there's 2 projects, which looks like it would be more significant, but if you look over here to the right again, it's a very small percentage. And so context, I'll start giving context. This 50% up here, this is a large reflection of that is VASH vouchers. There are a significant amount of VASH vouchers in Larimer County, and there's just not the capacity at this time to enter them into HMIS. This here is a reflection of some vouchers that were distributed, like motel vouchers that were distributed in Weld County on the night of the pit that are not necessarily like something that happened all of the time, but just happen to have vouchers on the night of the point in time count. And it's not really a formal program. And so really the emergency shelter coverage in Weld County is almost at 100%. So permanent supportive housing, you can see there's just 1 project that is not entering into HMIS, but it's 44% of the PSH beds in Weld County. And then transitional housing is pretty on par with how it's reflected in the terms of the projects, but you can see that there's 1 that is entering, 2 that are not. 86% of the beds are reflected within those 2 projects. Does anyone have any questions about the HMIS participation rates? All right. Any questions at all about anything Pitt or HIC before I wrap up? Awesome. Thank you.
Thanks, Rachel. My question is, how are you so good with Tableau?
It's half my job, so.
That's great. Fantastic. And as mentioned, there's a page on the NoCO CoC website with the point in time count. And I believe that currently the 2023 Tableau info is linked to from that. And there will be a link established for the 2024 as well. So thanks a lot, Rachel, and thanks for your great work. So the next thing is a quick update on the NoFo, the Notice of Funding Opportunity, the annual HUD competition. And if anybody has heard anything different, feel free to correct me. The NoFo has not yet, I think the term that gets used is dropped. It hasn't dropped yet for this year. Typically, I was reading within the last couple of days, it's typically in early July. And we have contracted with Kelly Pryor and KP Collective Concepts to manage the NoFo process this upcoming year. So we do have that capacity ready to go when the NoFo drops. And our expectation is that it'll be a fairly similar process to prior years. But one thing that we have heard is that this year may actually be a 2-year award for what is decided upon as awardable through the NoFo process. So we have heard that HUD is putting together a process that will be for the 2 fiscal years in the federal budget. So that'll be good news for if that is the case, we won't need to run a NoFo next year, a response to the NoFo. And that makes this year's NoFo all the more important to be a great process and for us to do, present ourselves as well as possible as part of it, because what would be decided during the current NoFo process would be locked in for 2 years. Has anybody heard anything different from what I just said? Feel free to contradict me. Okay, great. Well, so more details to come when we know more and when the NoFo drops and what things will be happening related to that. So now it's time for community updates by program type. And this is my first meeting to be managing in this role. And it was suggested that I actually ask for people to speak by the area of activity. So I'll just kind of click through the different areas of activity, and then we'll see if there's any updates by area. So the first of those would be, anybody know of any updates in outreach for helping us find people who are living unsheltered? Any updates there?
Lyle, I'll go first. The City of Loveland has started working on a contract with Summit Stone Health Partners to be the City of Loveland outreach team. I'm hopeful every day that I can finish the contract and send it to them. I'm hoping for today, so that we can get that going pretty quickly. And it's been a lot more difficult to write this contract than we thought it would be, but we're very, very close and really hope to have a signed contract back within a week or so that we can make a formal announcement.
Do you know about how many staff will be included in that
I do.
capacity?
It is 3.5 to start, I believe.
Great. Awesome. Okay, any other outreach updates? How about any updates in the discharge areas? So including law enforcement, criminal justice involvement. Anybody have any updates related to how we better do discharge from different institutional settings? Okay, what about any updates for the coordinated entry and assessment, the coordinated entry system?
I think that's me. Sorry. I unfortunately had to miss the last in-person meeting since I was out of the office, but I got updates from our team, and we're kind of finalizing a couple, like a survey and some other data to bring to the broader CAPS partners for their feedback to inform kind of how we move forward with our prioritization process. We're also meeting with our Lived Experience Advisory Council to potentially bring both the task force and that council together so they can collaborate and make sure that we're incorporating lived experience into this process as well. So more to come, but to our CAPS partners, if you're on this call, we should hopefully be reaching out to you for some feedback. So if you want to be involved in this process, just look out for the opportunity and please participate. But yeah, so moving along, but more to come.
Christine, what about the assessment, looking at a different assessment tool?
We're moving towards that. We're first focusing on the prioritization criteria, because kind of what we decide as those, what we think are the factors that demonstrate who is most vulnerable in our community will inform the questions that we ask on that tool. So we're moving closer to having prioritization kind of somewhat determined, and then we'll move forward to the assessment tool. But right now, the Lived Experience Advisory Council continues to look through other communities' tools and provide feedback on kind of what questions they like, what they don't like, what not. So we'll have a lot of information to kind of filter through.
Great. Any other coordinated entry and assessment updates? Okay, how about emergency shelter updates?
I can talk about Fort Collins Rescue Mission. We closed down our seasonal overflow shelter in partnership with the city of Fort Collins last month, and we have an initial spike in turnaways simply because we lost 70 shelter beds, and so we turned away anywhere from, I think it was 24. Now it's back down to 0 for people last night, I believe. And we'll extend that hopefully again when winter weather comes up, hopefully October, November. We are also in the planning and zoning process for a building permit, approval to build a new 250 bed emergency shelter in North Fort Collins. That is going slowly, but last week we had an appeal of another process that was with the city that needed to get shut down in order for us to continue that process. And that happened not this immediately past Tuesday, but the Tuesday before that. So that is a good outcome. And we have many more events like that we are planning on weathering in order to get to actual groundbreaking in North Fort Collins. I think that's about it for me.
Thanks, Seth. Any other emergency shelter updates?
I could offer an update for Catholic Charities of Larimer County. So for emergency families, we are at capacity there and taking names on a wait list. So if you have a family in an emergency, call ahead for them. And then for single women, we are on a lottery at 4 p.m. and a lottery at 8 p.m. So capacity is still high for both populations.
Thanks, Katie. So for Well County is that City of Greeley provided additional funding to United Way of Well County to keep the Housing Navigation Center emergency shelter open. And the amount of money was sufficient to have the 60 beds there still available every night, and actually doing our 24/7 thing where we're continuing to have weekend hours as well through the end. I think it's through the end of July. It's likely that money will go a little bit further, but we'll continue to do what we started doing back in December, where it was 24/7 for the whole cold weather season. We'll continue to offer that capacity at least till the end of July. Any other emergency shelter updates? Okay, how about case management? Any case management expansions or anything? I guess it'd be maybe general case management for people who are unsheltered, or just any case management updates that come to mind for anybody. How about any healthcare updates, physical or behavioral healthcare updates, some any kind of expansion or refinement of programming? Is the and sorry, I'm not fully aware of everything going on regionally, but the healthcare that's being provided through Murphy Center, is that something that's going, or is that still not yet open?
I don't know that anyone from Homeward Alliance is on the call, but the
okay.
clinic is open. And the health clinic at the Murphy Center has been open, I think, for a little over a month, maybe. And they're actively seeing guests.
Okay, great. Thanks, Rachel. So any updates related to housing? So housing development, housing placement, any updates on housing retention for people that have been in housing?
So we've been talking about the Star Rise development that is happening here in Greeley, 58 units of permanent supportive housing for our chronically homeless population. And so we're about a week and a half to 2 weeks away from closing, and we'll be starting construction in June. So there is new housing coming, new units. We're pretty excited about that. There will be a groundbreaking on June 20th, and we'll be sending out an invitation to everyone. So please come and find out even more about the property and see what a unique project this really is.
Jody, do you have your gold shovels already? You can buy some or borrow some, or?
Oh yeah, we'll have enough shovels for everyone to get their picture taken if they'd like.
Okay, I
Jody,
think
can you put that in the chat as well?
What's
Not the
that?
shovels, but the date and time.
I will, yes.
Yeah, and if you could put the address as well, Jody.
Yeah.
Yes, and so again, you will receive an electronic invitation sometime in the next 3 days, so watch for it.
Any other housing updates?
I can share that the Greeley Weld Housing Authority is hiring an executive director. After 29 years, Tom Textera, the current executive director, is retiring at the end of June. So we wish him the best of luck. And so, yeah, the board has started the look for a new executive director. I think the job description was sent out to this contact list maybe a week or two ago. So please send people our way. We're very excited. Sad to see Tom leave, but excited to get someone on board, because as you can imagine, there's a lot of work to do. So.
And Sean, is it correct that you're the chair of the board for the Greeley Weld Housing Authority?
Yeah, I'm the current interim chair.
Okay, great. Thanks for doing that. Any other housing updates? Okay, how about just any other updates that come to mind for anyone?
I did want to do a quick update. Here, I'll turn my camera on while I'm talking. Hello, everyone. Just from the CoC board. So as you all saw in the newsletter, we're looking for members for our committees. So I just wanted to throw that out there to you all as well. We would love to have you participate. We need members for our board development committee. So if you're interested in learning about the CoC board, how we build the board, you could be part of that committee. I think it's a good stepping stone if you're ever interested in joining the board to learn about those processes and such. We're looking for members for our data and performance committee. So if you really loved our point in time count presentation today and the data that we were talking about, and you have more questions and you want to dive deep and help us provide this data more robustly to the CoC as a whole in our communities, that would be a really good one for you. We need members for our membership engagement committee. So that committee helps us come up with those trainings. So if y'all remember last year, we hosted that domestic violence training. There were so many people that attended that training that we had to record it and send it out. The Zoom had to close because we had so many people interested. So we want to make sure that we're providing those trainings for you all more actively and more often. And we're only able to do that if we have a robust committee on our membership engagement so that we know what you want to see and what trainings you're looking for from the CoC. So that would be a really good one if you like to do those types of planning, and if you have a training in mind that maybe you want to help host or put together. So that's another one. And then the last one is our project rating and ranking committee. So Lyle had spoke earlier about the NoFo, or the notice of funding. So that is federal dollars that get funneled down through our Northern Colorado continuum of care to fund the great work that's happening around rapid rehousing, transitional housing, our permanent supportive housing. Some of those projects get money through the CoC and they apply through the NoFo. And our rating and ranking committee is responsible for reading those applications, ranking them, and then presenting who should get those awards to the board. So if you're at an agency that will not be applying for those funds, but you'd like to learn about that process and you'd like to see the projects that come through and learn more about that, that's a really fun committee to be a part of as well. So those are the 4 committees we're looking for members. There were 50 people on this call at one point, so I'd hope that some of you are hearing this call to action and are able to participate. It won't be a huge time commitment. I'm more happy to share more details. Just reach out to anyone on the board. You can reach out to Lyle. You can reach out to myself. Let us know if you're interested. Thank you.
Thanks, Aaliyah. Any other announcements for today, or any reflections or anything that anyone has to say? Great. So our next meeting is Thursday, July 18, and that's again from 9 to 11 a.m. And I expect that will be virtual again. So that's Thursday, July 18. If you could put that on your calendar, 9 to 11 a.m., that would be fantastic. And thanks to everybody. Thanks to the governing board. Thanks to the staff. Thanks to all of you. There's a couple of funders on this call. Thanks to the funders. And thanks to all of you for all the hard work that you put in. I do think, I'll say we have a great CoC. We do a fantastic job, and it's because of you all and your work and the staff of the CoC and also the governing board. So thanks for all you do, and I hope you have a great rest of the day and a great rest of the week.
Thanks, Lyle.
Take care.